Dear 2K24, the way you prepare for your practical exam is completely different from the way you prepare for your theory exam, isn't it? So when you go and scan for your gross anatomy spotters, please remember you're going to differentiate between the artery, the vein, and the nerve. The sub-question itself can be a clue to the answer. For example, if they're going to ask you tributaries, then it's going to be some vein. And for arteries, the sub-question is mainly about branches, name its branches. And very commonly in upper limb, for musculocutaneous nerve, they're going to ask you, how does it terminate? You know that the musculocutaneous nerve terminates as lateral cutaneous nerve of forearm. Also in upper limb, the intermuscular spaces around the axilla, the boundaries and contents are really important. Both in upper limb and lower limb, the retinacula, the flexor retinacula, extensor retinacula, the structures passing underneath are of course very important. Okay, and irrespective of the region, all the important muscles, right? You should know the nerve supply and action, applied anatomy. Okay, coming to thorax. Thorax, of course, phrenic nerve, vagus nerve, the left recurrent laryngeal nerve winding around the arch of aorta, the three branches of arch of aorta, right? And the, of course, very important, the left brachiocephalic vein. Hope you'll be also able to identify the thoracic part of the sympathetic trunk, the thoracic duct, if pinned, isn't it? Okay. And over the external surface of the heart, the anterior and posterior interventricular sulcus, they can be pinned and ask the contents lying there. Okay. The interior of right atrium and the right ventricle are equally important. Okay, very frequently the fossa ovalis, they can ask you what is it an embryological remnant of. Okay, and then also about the lung, the structures at the hilum of the lung. Okay, both you should be able to differentiate whether it's the right lung or left lung. The structures in the hilum of the lung, arrangement from above below, from anterior to posterior. Okay, and the impressions over the mediastinal surface are very important. In abdomen, all the viscera, stomach, duodenum, pancreas, spleen, the liver, the gallbladder, cecum, appendix. Okay, all of that you've prepared very well for your essay question, isn't it? And they are very important for soft part discussion also. So all the important points you should have at the tip of your fingers and impress your examiner in case of soft part discussion. Okay, and also coming to the male and female pelvis, definitely one will be kept up. So you know that immediately behind the pubic symphysis, it's going to be the urinary bladder. In front of the sacrum, yes, the rectum and anal canal. And in case of a female pelvis, in between the two, the uterus. So please pay attention to where the probe is put, right? When you ask to identify the probe space. If it's going to be in front of the rectum, that's going to be recto-vesical pouch in case of a male pelvis, recto-uterine pouch or pouch of Douglas in case of a female pelvis, isn't it? In front of the uterus, it's going to be vesico-uterine pouch. And if the pointer is going to be put over the below the urinary bladder, in case of a male pelvis, that's going to be the prostate. That's also frequently asked. Okay, head and neck over the face, very frequently if you get to see the facial artery or facial vein, they can be tied. The parotid gland with a parotid duct, the buccinator muscle lies bit deep, the masseter muscle you cannot miss, the orbicularis oculi, orbicularis oris, all those are very, very, very important. In the neck, sternocleidomastoid, the suprahyoid, infrahyoid muscles, especially the digastric, anterior belly of digastric is supplied by nerve to mylohyoid, isn't it? From the mandibular division. And posterior belly of digastric along with the stylohyoid innervated by facial nerve, isn't it? The midline structures of the neck, especially the thyroid gland, the arteries and nerves reaching it, the thyrohyoid membrane and the structures piercing it. Common carotid artery, external and internal carotid artery, they are branches. Internal jugular vein, all are very important. Coming to the sagittal section of head and neck, the tongue, its development, nerve supply, lymphatic drainage, muscles, everything is a very, very important topic. The soft palate can be pinned, muscles contributing. Okay, the nerve supply, what will happen if it is injured, paralysis, all that clinically very important. Coming to nose, the nasal septum, its formation, Little's area can be shaded. Kieselbach's plexus epistasis, lateral wall of the nose, the three concha, the meatus, right? What opens into it? Inferior meatus, middle meatus, superior meatus. And the sphenoidal sinus can be probed and can be asked, where does it open into? Sometimes the sella turcica with the pituitary gland can be intact. Okay. Apart from this, yes, and the orbit, sometimes, okay, the dural folds, that also, if kept, you should be able to identify it. And then coming to brain spinal cord, yes, phylum terminal, chorda equina, conus medullaris, sometimes the dorsal root ganglia. Brain, cerebrum, the sulci gyri, very commonly the central sulcus, the lateral sulcus, okay, and gyrus, the sensory speech area, motor speech area, superior parietal lobule, prefrontal gyrus. Medial surface of the cerebrum, corpus callosum, what are its parts? The lateral ventricle fornix, the cingulate gyrus, and very frequently paracentral lobule, right? That's very important clinically. Which part of the body is represented here? What is the blood supply? What will happen in case of its occlusion? Very important. And then, of course, I'm sure you're able to identify the thalamus, the hypothalamus, right? And mammillary body in the region of floor of hypothalamus, the midbrain, the cerebral aqueduct, the superior inferior colliculus, above the superior colliculus, the pineal gland, right? Pons, over the ventral surface of the pons, the basilar sulcus that lodges the basilar artery can be pinned. And behind the pons and upper medulla, the cerebellum. So the superior, middle and inferior cerebellar peduncle, they can be pinned. Afferents and efferents passing through it are very important. Coming to medulla, very frequently, the pins can be put over the pyramid, the olive, what lies underneath it. Pyramid, underneath it is the corticospinal tract. Olive, underneath the inferior olivary nucleus, right? It's going to be easy. Soon, when time permits, I'll give you a list of the important spotters that you should be thorough of. Thank you.